I am Dr. Vishnu Swaroop Reddy, head of the department of ENT, facial plastic surgery and head and neck surgery, and I am also a cochlear implant surgeon. I would like to tell few words about cochlear implant surgery. Cochlear implant surgery is advised for children, newborn, and adults who are having severe to profound hearing problems. The cochlear implant is a real wonderful thing. It can make them hear. In small children, those who are born deaf, early recognition is very important. If the diagnosis is done early recognition of hearing loss, and cochlear implant surgery is done for them, then they are the best candidates to develop normal speech and to go to normal schools. And that's why the message here is earlier the better. See, even the maternity hospitals, when the child is born, the hearing test is done by acoustic emission and then by brainstem evoked response audiometry to confirm the hearing thresholds. And at that stage itself, the child will be followed, and cochlear implant surgery can be done as early as 6 months in life, and that's going to make them lead normal life. And in the same way, even adults, for whatever reason, if they have lost hearing to the extent of severe to profound deafness, when they are not getting any benefit using hearing aids, they are the best beneficiaries of cochlear implant surgery. Cochlear implant surgery is, I would say, is fairly safe procedure. And in the cochlear implant, you have two parts. One, the implant is implanted here, just behind the ear, on the skull, and there is a sound processor which is outside. So the sound processor grasps the sounds from the atmosphere, and through a magnet it will be holding the inner device and transmit the signals through the electrode into the cochlea and then through the cochlear nerve to the brain. That's how the external sounds are transmitted from the atmosphere into the brain, and then you will be able to hear. So this procedure is done as a daycare or with one night stay, and it takes about 2 to 3 hours. And bilateral cochlear implant surgery means some newborn children, we can also do cochlear implant surgery to both the ears at the same time as well, and these children will get the benefit of sound from 360 degrees, and they can hear from any side called if they get the cochlear implant surgery done for both the ears at the same time. So these children, infants, I would say, if they are diagnosed early, and cochlear implant surgery will be the best boon for them to lead the normal life. At the same time, as I said earlier, adults who have severe to profound deafness for whatever reason, it may be diabetes or because of aging problem or head injury or any other infections, if they lost hearing in whether one ear or both the ears, by cochlear implant surgery we can get the hearing back to them, and they can lead normal life, they can go back to the work. And we started cochlear implant program in the year 2007, and we have nearly 300 cochlear implants have been done at care hospitals. And the cochlear implant surgery, interestingly, we started doing under local anesthesia also in the last few years. For those adults who are not fit for general anesthesia, it can be done under local anesthesia with a small injection here, pre-medication an hour before, and an injection here that will freeze that area, and then after doing a cochlear implant surgery, and once we connect with the sound processor, and the audiologist, when they test whether all the electrodes are working, at the same time, the patient starts saying to us that I am hearing. The instantaneously the patient is experiencing the hearing and expressing during the procedure, particularly when we started doing this under local anesthesia for adults, and it's really thrilling for us, which is not being practiced all over the world. But interestingly, we were forced to start this surgery for a patient who had only one lung and he was not fit for general anesthesia. That's how we started cochlear implant surgery at Care Hospitals, Hyderabad. We have full-fledged ENT department supported by audiology department with a highly experienced audiological team for cochlear implant rehabilitation, for mapping, and for auditory verbal therapy. And whoever, whether infants, children or adults at Care Hospitals, we are happy to extend our services of cochlear implant surgery and rehabilitation whoever in need. Thank you.